Allison Basut receives regular maintenance therapy as part of her treatment for ovarian cancer. She was diagnosed last year.
I started having symptoms like shortness of breath, weight gain, bloating, things that I was putting off on not enough exercise, being menopausal, all sorts of things my age. And they say with ovarian cancer, it sometimes isn't easily found and not found until it's late stage. So unfortunately, that was the result for me when it finally happened after multiple symptoms after a couple years.
After receiving her diagnosis, it was recommended that she do chemotherapy and surgery. Thanks to collaboration between the Avera Cancer Institute in Sioux Falls and Marshall, she has had a good balance of keeping most of her treatment close to home.
Sioux Falls for my first treatments, follow-up treatments here in Marshall, then my surgery in Sioux Falls. And I was able to do most of those chemo sessions here in Marshall, which was wonderful. I live close to town and I work in town. So I didn't have to take a lot of time off from work, which was a bonus.
Her gynecologic oncologist is David Starks in Sioux Falls, and she also sees certified nurse practitioner Jess Moriarty in Marshall.
Dr. Starks and I have worked together for a long time, but when I also know the patient, if something comes up mid-cycle or mid-treatment, or say a patient is struggling with some of the side effects, or even if they get sick with something else, I can see them because I already know them. And it's not like trying to figure out who are you, what's going on. There's already a relationship built there and a confidence level, which is nice.
How are you doing?
I'm doing well.
Even though Dr. Starks is almost 2 hours away, Allison can meet with him via telemedicine during her appointments.
It's just like he's right here in the room. You can tell he cares. He knows all the little details just from kind of the pre-scan they do here, the evaluation, the blood work. He knows everything. And I think that comes with a good partnership between Jess and Dr. Starks. And just between, I think, both facilities, it makes him feel like he's right here in the room with us.
And Moriarty can be there to answer any question she might have even after the call has ended.
What we try to do is also have myself be a part of that visit, because sometimes you sit there for a little bit and realize, oh, I forgot to ask that. So then that allows me to come back in and answer some of those questions. So it's a really good combination.
A combination that has allowed Allison to feel confident in the care she's received right in her own community.
They're just right on top of it. If it's not Marshall, it's Sioux Falls taking care of it. There's always somebody taking care of me.
They trust what's happening in Marshall is the exact same thing that's happening in Sioux Falls. We utilize all the same protocols with our treatments, so it's not that patients are getting a very different treatment plan. They're able to get the same treatment in Marshall as they do in Sioux Falls.